You see, diastasis recti is a trauma that happens after you have a baby. The linea alba, which is the white fascia that surrounds, envelops the whole little midline that you have, that fascia goes around each of those abdominal muscles. When you have a baby and the rectus abdominis and the linea alba is stretched to failure, those things are lengthened and weakened. Now, we can do transversus abdominis exercises, we can do pelvic floor exercises because that's what we've always done, but it doesn't mean it is the most effective and changing therapy you can do. I'm seeing all these things to say, do crunches and it won't heal diastasis recti. It's a little true, but it's actually not. So here's what you can do. You can't throw the baby out with the bathwater. When you are working to heal a diastasis recti, you are a complex system. You are not a one item thing. You have your pelvic floor, your transversus abdominis, you have your rectus abdominis, you have fascia. But what you don't have is a one exercise solution. And if you are only doing pelvic floor and TA to fix your diastasis recti, you will never fix your diastasis recti. So I'm doing research on this, and I'm going to tell you, when I'm working with these subjects, patient after patient, days in a row, you start to see a trend. Now, this is not what I'm measuring in my research, but I'm telling you this because here's the thing. Function is the greatest thing that we have to solve with women. Function. Women cannot sit up from lying down. Guess what fixes working on sitting up from lying down? Doing the actual action that you stink at. Do you know what that would be called? A sit-up. Do you know what a modified version of a sit-up is called? A crunch. Do you know when you look at EMG studies of strengthening for rectus abdominis, the greatest thing to cause growth in your rectus abdominis? A sit-up and a crunch with your TA. I'm going to blow the doors off this and say your pelvic floor doesn't matter as much as you think. Stress urinary incontinence isn't as involved in diastasis recti. What is involved? Poor body image, poor function, and what else is involved? Upper back pain, greater than low back pain.